Good morning to all. I am Sumi, lecturer in pharmacology. So today we are going to discuss about general anesthetic agents which are used in surgical anesthesia. So coming to introduction, what is general anesthesia? General anesthesia or general anesthetics, these are the agents or drugs which causes reversible loss of all sensations and consciousness. Okay. So coming to various stages of anesthesia. First one is stage 1, then stage 2, stage 3 and stage 4. The stage 1 is the state in which the patient become analgesic, that is loss of pain. Next stage is delirium stage. In this stage the patient become excited. Then surgical anesthesia stage, which is the stage 4 anesthesia. During that time the patient will be unconscious but patient have regular respiration. Then the next stage, that is respiratory paralysis stage, where the patient will not have any eye movement and respiratory and cardiac arrest will be possible during this stage. So coming to the essential components of general anesthesia, there is cardinal features such as loss of all sensations, sleep and amnesia, immobility or muscle relaxation, abolition of all reflexes actions. So, we can classify general anesthetic agents into two types. They are IV anesthetics and inhalation anesthetics. Intravenous anesthetics are the agents which can produce rapid induction of anesthesia. So example is thiopentone sodium, propofol, etomidate. Then slow acting agents. Example is benzodiazepam such as diazepam, lorazepam. Then opioid analgesics such as fentanyl and remifentanil, sufentanil, etc. Then dissociative anesthetic agents such as ketamine. Neurolept analgesia is also obtained. This example is fentanyl with droperidone. Okay. So, next one is inhalational general anesthetics. First one is nitrous oxide, which is a gaseous anesthetic agent. Then volatile liquids such as ether, halothane, enflurane, isoflurane, desflurane, sevoflurane, etc. Okay, here we can see the induction of anesthesia, then followed by maintenance of anesthesia, then recovery to normal state. The IV anesthetic agents mainly act on induction phase of general anesthesia, whereas during maintenance phase we can give inhalation anesthetic agents. Okay. So coming to IV general anesthetic agents. So as we earlier said, these are the inducing agents in general anesthesia. So coming to the mechanism of action of IV anesthetic agents, thiopentone sodium, propofol, benzodiazepam, all of the agents which facilitates the binding of GABA to GABA A receptor. As we know, GABA is an inhibitory neurotransmitter. When this GABA binds to GABA A receptor, what will happen? The inhibitory neurotransmission will be obtained, that is there is no impulse transmission during this phase. Okay. Then ketamine. Ketamine is a dissociative anesthetic agent which mainly block the NMDA type of glutamate receptors. So here we can see the sites of action of various anesthetic agents. Here is GABA A receptor is also there, chloride channel, 2 alpha, 2 beta, gamma subunits, etc. Okay, when these drugs which facilitates the binding of GABA to GABA A receptor, what will happen? There is an increased influx of chloride ions into the cell, and this increased influx of chloride ion causes membrane hyperpolarization and CNS depression. The mechanism is explained with the help of a flowchart. So that is the thiopentone propofol benzodiazepam, which facilitates the binding of GABA, increases the GABA chloride channel opening, membrane hyperpolarization and CNS depression. So coming to thiopentone sodium, which is an ultra short acting barbiturate. Okay, mechanism as we already discussed. So coming to the kinetics behind thiopentone, which has a rapid onset of action due to its high lipid soluble nature. Within 20 to 30 seconds, it will produce its effect. And also rapid recovery due to redistribution property. So the advantages of thiopentone are rapid induction and rapid recovery within 7 minutes. It is used in induction of anesthesia. Whereas it has certain disadvantages such as depression of respiration, myocardial depression and poor analgesic effect also. So this is the redistribution property of thiopentone sodium. When we give thiopentone sodium as IV, it will rapidly distributed into brain, and in brain it will produce its anesthesia state, followed by it will get rapidly redistributed into various skeletal muscles. Okay, so due to this rapid redistribution property, the anesthesia effect will be abolished or diminished. Okay, next one is propofol. Propofol is an agent used mainly for daycare surgeries. Then the advantages of propofol are rapid induction of anesthesia, rapid recovery. It has also anti-emetic activity, that is post-operative nausea, vomiting become less. Then it will not produce any irritation to air passages. The disadvantages are respiratory depression, depression of myocardium, fall in BP, that is hypotension, poor analgesic effect, severe pain on injection. So they are mainly used for the induction of anesthesia and maintenance by a continuous infusion of propofol. Next one is ketamine. So ketamine is a dissociative anesthetic agent which can produce sedation, amnesia, analgesia, and feeling of a dissociation from the surroundings. And their mechanism of action, they mainly block NMDA type of glutamate receptors. The advantages of ketamine are analgesia, increased BP, bronchodilation. So they are safe in asthmatic patients. Whereas it can produce emerging delirium, hallucinations, etc. And it is contraindicated in hypertensive patients and psychiatric patients. Next one is benzodiazepams. Benzodiazepams, we discussed about in detail benzodiazepam during sedative hypnotic studying time. So benzodiazepam, these are the slow inducers of anesthesia. The anesthetic uses of benzodiazepam are as a pre-anesthetic medication during diagnostic and surgical procedures like endoscopy, cataract surgeries, angiographies, for conscious sedation also. Okay, next one is neuroleptalgia. What do you mean by neuroleptalgia? That is, anesthesia can be given by giving an analgesic agent and neuroleptic agent. Neuroleptic agent is droperidol, and analgesic agent, that is fentanyl citrate. The advantages of neuroleptic agents include the patient remains drowsy but is cooperative also. They are mainly used in minor procedures such as endoscopies, burn dressings, etc. Okay, so these are all about IV general anesthetic agents. So thank you.